Tim Ekpo and physician's assistant Nick Dyer. Good morning, guys.
Good morning.
Morning.
Good morning.
I always get a little knee pain when you're here. I don't know what that is.
I think it's because I visit during the winter time a lot. So.
What's the biggest cause of knee pain?
Primarily it's a combination of maybe a post-traumatic injury, or maybe you tweaked it, maybe you turned your knee a little bit, or in our case, what we see a lot is arthritis. Right?
Okay.
So if you've got arthritis of the knee, especially this time of the year, you're really going to feel it.
Yeah, that's pain.
Dull, achy pain.
Yeah.
You guys specialize in the Jiffy knee, and people come literally from all over the country to have this revolutionary procedure done at MJRI. What would you say are the benefits when people say, why would I go with the Jiffy knee? What are the benefits?
Yeah, so we started the Jiffy knee about 2 years ago, essentially when we opened the Michigan Joint Replacement Institute, and we were looking to do something innovative, bring something different to the field of orthopedic surgery in Jackson and the surrounding areas, and it's a minimally invasive technique. And I'm going to actually let Nick talk a little bit about what patients actually see and experience, primarily because he sees a lot of our patients in the office, and I think he could share his perspective.
Sure. Yeah, I think the big thing that we're hearing from people is we'll get some patients that have already had a knee replacement, just kind of the traditional knee replacement, and what we hear a lot of is that they feel like their recovery is quicker. They're able to get going, get their range of motion back sooner, which is a big deal. I think because it gives you the confidence to really kind of get back to your normal life. We get people that are back doing things that if they asked us, hey, can I go golfing? Can I go, do this big hike? We'd probably say not yet, but they do it, and they're feeling up to it. So, that's a real positive.
What do you think of things like, just being able to get in your car and drive sooner? I mean, so important.
Yep.
It is. Sometimes we see it, we find ourselves kind of pulling the reins back a little bit.
Yeah.
One of our patients, she's just a great person, in the community, and had a Jiffy knee replacement, and she asked if she can go water skiing 4 weeks after her knee replacement.
Oh, I know who that is.
And she did it.
She's got video of it. Yeah.
What's a typical day of recovery like? After your first few days.
I think it's dependent on the patient, but for the most point, they're they're going to be a little sore, obviously, but they're ready to. They get into therapy 2 days after surgery.
Wow.
Yeah, 2 days after surgery, and they're kind of pushed really quickly. So,
Dr. Ekpo, who's best suited for this procedure?
I think initially when we started this procedure, it was anyone who was having knee pain. Obviously, diagnostically, they had arthritis and they were ready for a knee replacement. We started fairly conservatively with, kind of picking and choosing patients that we thought would be right for the procedure. And it's been such an amazing procedure. Patients have done so well that we've really extrapolated that to our entire patient population.
Oh, wow.
So there are very few patients that walk into our office that aren't an actual candidate for a Jiffy knee.
So if you've had like one knee done, 15 years ago, do you think then eventually the second knee is going to have to be done?
Yeah, I think that's typically the case. Usually, in your lifetime, if you've had, especially if it's again post-traumatic, you've had some injury, you tend to favor one side versus the other. So, in that 10-15 year period, you may end up with the other side done. Not always, but sometimes.
We've had some great high school sports on JTV, and thanks to you for helping us bring high school sports to the Jackson County audience and beyond, and we have a little clip.
90 seconds just about gone by in this second quarter of play. Jump stop, kick out, baseline drive, throw it off the glass, and one for Jack Kriegel. Kriegel driving through the contact to get the Dr. Ekpo and one, the second of the game. He'll go to.
Love it.
Yeah, love it. We always have to attach you to a very exciting play.
Please do.
Yeah.
Please continue that. Please continue that.
And now I wanted to ask you, because I know you spent some time in Miami or Indiana. Okay, all right.
We're ready.
That's
I'm
what
ready.
I was wondering.
Let's go.
All right. Well, quite the alumni on the sideline.
Always. They're always
this time of year.
Yeah, they show up. They definitely show up. Indiana looks really strong though this year.
Yeah.
I mean, they just look amazing. They've got a lot of seniors, and it's going to be a great game.
Yeah, I'm excited for it.
Suddenly there are millions more Indiana fans.
Yeah, it's amazing how that
Right,
well, the alumni are finally speaking up.
Right? They have an opportunity to, so
Yeah,
why not?
that should be a great game, and I think it proves that Notre Dame shouldn't have been in the playoff.
So the Jiffy Knee, I like the name because it really conveys speed. Return. You're going to get back. It sounds like. Is it more expensive? Is there more to it?
As far as the cost of there's no additional cost. It's there's a little more finesse and technique with the procedure itself. So instead of a traditional incision where we cut through muscle and cut through tendon, and I'm not saying that there's anything wrong with that, but that's just what we've done for decades of doing knee replacement. Now we just tend to move all of the muscle and tendon over to the side, and so it gives us the ability to access the knee without cutting through that muscle and tendon. Everything falls back into place, and that's why the rehab and the recovery is so much quicker, and that's also why patients have less pain and take less narcotic pain medication.
Right.
And that's pretty critical. And they're not calling, after their prescription runs out for more, are they?
Not as much. No, definitely not. Yeah.
Yeah. What excites you about seeing these patients after recovery?
It's kind of they get a sense of being a part of something that's cutting edge, and so like patients are pretty excited. They kind of like to show off when they go to the therapy and somebody else has got like the traditional knee.
Yeah.
Somebody saying, "Hey, why are you moving so much better than I am?" And it's kind of fun to be a part of that team that gets to say that.
What's the best time of year to do this? Does it depend on what your activities are?
I think it varies. A lot of it is seasonal, and I say seasonal for workers. If you're a teacher or if you are, someone who's free in the wintertime or the holidays, it's usually why, December is probably our busiest month. And then typically we live here in Michigan, so we like to enjoy our summers. So it does slow down just a little bit. Patients don't typically like to have as much surgery in the summertime.
Awesome. Well, we appreciate having MJRI in our community.
No doubt.
And we appreciate you guys being part of JTV. Thanks for your partnership. And thanks for coming on the show today.
Thank you. It's always a pleasure.
Yeah. Thank you, guys.
Thank you.
From Michigan Joint Replacement Institute, Dr. Tim Ekpo and physician's assistant Nick Dyer. More of the morning show after this.